Hi, everybody. I'm your host, Debbie Foreman, and I'm the Educational Programs Coordinator for MS Focus. I'd like to introduce our wonderful guest speaker, Cherie Binns, who will be presenting her bi-monthly Q&A called Ask the MS Nurse Your Symptom Management Questions. So Cherie is an MS certified registered nurse who is also the patient healthcare liaison for the Multiple Sclerosis Foundation. Cherie, we're always pleased to have you join us. I'm glad it's today, and I'm sure that the attendees are really excited to ask their questions to you. So let me just share with everyone what I do each time, and we're hoping everyone will listen this time. Please, please, please keep your questions in the Q&A area. I know there's two areas, the chat and the Q&A. We are going to try to not take the questions out of the chat area, reserve only the Q&A area for all of your questions. So if you have a question, you can ask it by the Q&A button in the app, or you can just raise your hand using the app, and I'll call on you and I'll unmute you. So if you're on a phone, you can always hit *9 if you'd like to ask your question live. We can do it that way. So let's start. Let's see if we have any questions yet. And we do not, but I'm sure they're coming. So Cherie, would you like to say anything before we get started?
I'm seeing a lot of questions, or actually research that is being highlighted lately on the microbiome or the gut biome with MS and causative factors for that. This is research that we really had well underway when the pandemic hit, and it had to be put on hold because we couldn't be testing fecal bacterial transfer during a time when people were being exposed to COVID. Just because people were actually taking for these clinical trials, they were taking capsules filled with freeze-dried fecal material. So we were putting that in a capsule form to get into their gut to change the gut microbiome and hopefully reduce inflammation. That was showing quite a bit of promise. We really haven't gotten any great way to treat the microbiome yet, other than changing our diets, getting rid of preservatives, highly processed food, anything that's got ingredients in that don't sound like food products. Um, Getting all of that stuff out of our diets does reduce inflammation and changes our gut microbiome back to a more normal flora in the GI system. So if you're reading those articles and had questions about those, that is in the news in this last week. There's also been several more articles that have come out during the last week on Epstein-Barr virus and its role in turning on the ability for somebody to develop multiple sclerosis. Epstein-Barr virus doesn't cause MS, but it changes our immune system to where if you have a gene that is susceptible to you getting MS, it may turn that on so that down the road, the impact of your having had Epstein-Barr virus or mono has the ability to be causative for that. We are fairly well along right now on a vaccine for Epstein-Barr virus, so that if it's added to childhood vaccines, we likely have the ability to turn off that ability for Epstein-Barr to be, well, Epstein-Barr, if they're getting the virus or the vaccine, they won't be getting the Epstein-Barr virus. So that's not going to turn on that button in the immune system so that you can develop MS at some point down the road. So those are the two big things I'm seeing in the research at the moment.
Thank you. Cherie, how common is Epstein-Barr? I know my daughter had mono when she was a child, but I don't know anybody else that did.
95% of us have had it and we don't know we've had it. Um, so it's we may have thought we had a cold. People in the mid-teens to mid-20s seem to get it more severely than other people, and it can have specifically a lot of liver ramifications with it. I I've seen a lot of people end up with hepatitis as a result of Epstein-Barr, and those people generally take a couple or 3 months to get over the the
Wow.
infection.
Wow. Okay, so our first question is here. Sherry would like to know, what is your opinion about the Octave biomarker panel blood testing? Her neurologist has ordered this test for her, and she just wants to know if you've had any experience with it.
Sherry, you spell your name just the same way I do. I've met very few people in my life that do that, so a little kindred spirit here. Octave is a biomarker panel of 18 different biomarkers that look at a number of different things. This is a panel that normally costs about $400 to have done. Some insurance companies pay for it, others don't. Um, Really, there's one biomarker in it, the neurofilament light chain, which, if elevated, may indicate that you either have MS or your MS is poorly controlled and you've got high inflammation in your system. The thing is, it's not specific to MS. None of the tests in the panel are specific to MS. The biomarkers that may be elevated are usually elevated because of inflammation at some place in the body. So they're used for things like rheumatoid arthritis or MS or Parkinson's or Alzheimer's, because all of those will have elevated levels that show that there's inflammation in the central nervous system. They're relatively um, they've been out now for probably about 5 years. So they've kind of gotten the kinks out and they're helpful, but a lot of our doctors don't really know what to do with it. Um, and again, it's not diagnostic for MS, but it can give your neurologist an idea if there's a lot of inflammation going on in your system right now. If there is, that may mean a conversation about changing your disease modifying therapy, or if you're not on one, putting you on one. It may mean that you'll get some extra counseling in how to eat a less inflammatory diet. Um, so those sorts of things help. There's also the thought that if this test, this biomarker panel, or even just the neurofilament light chain is done um, quarterly, we may be able to do away with the annual MRI and maybe do the MRI every 2 years. And that would be more cost effective than doing the MRI annually in the long run. So that conversation is taking place.
Thank you. Deepa is asking, is red and near IR light therapy helpful for pain and fatigue management for MS? And how does she go about getting it?
Physical therapist would be able to do that therapy with you. Um, I have had red light therapy many times for hip pain. Um, I have chronic left hip pain and have had since the early 1990s, and I have never found it to be helpful. I keep getting it recommended every time I go into the physical therapist, though, and while we're here, let's just do it. But I haven't noticed any real improvement with it. That's not to say that you wouldn't. So it certainly would be worth giving it a try. But again, the physical therapist is where you would find that.
Okay, and we do have Shelley who's raised her hand. So
Okay.
let's see. Let's go to her. Shelley. Okay, Shelley, I just gave you the ability to talk. You just have to unmute yourself. There you go. Hello, hello.
Hello, can you hear me?
We
I
do.
can, Shelley.
Okay. So what do you think? I've heard ivermectin is helpful for MS, and I know the medical community doesn't like to talk about that. Um, and what can you say about that, if anything?
Steer clear. It is a hoax that it helps MS. It does not. And Dr. Boster got that same question last month, and he said the same thing. We keep hearing more and more about ivermectin. And there seems to be a small group of people out there that are stirring the pot and keep bringing this to the surface. It is not something that should be considered, and it is often not safe for humans to take it.
Okay. All right, thank you.
You're welcome.
Thanks, Shelley. Um, Michelle wants to know, is cryotherapy helpful?
Not generally. You'll find help for things like spasticity or pain with thermal therapies, hot or cold therapies. Cryotherapy is generally a freezing, um, and we really haven't found that to be all that helpful. For one thing, you can go a little bit too far and damage tissue with cryotherapy more than you would if you were using ice packs or cooling. So I really haven't seen anything very promising in the literature about cryotherapy for help with any of the symptom management for MS.
Hmm. Sherry, what are your feelings on, this might be a physical therapy question, but swimming, or like walking in the pool. Do you think that helps?
I think that one of the reasons why it can help, particularly if you're not walking much, if you've got pain with walking, it relieves the a lot of the pressure on your skeletal system of gravity. And so your body is lighter. So you're not carrying the weight as you're walking in the pool. And that walking in the pool actually will be reconditioning the muscles in your body, particularly in your legs. It can be helpful for fall prevention. It can be reconditioning. It can be strengthening. Um, Even if, I've seen people actually have trouble staying upright. But the pool helps, particularly if you're using a pool noodle or something like that. Um, and in those individuals, as they've gotten accustomed to walking in the water, may even add ankle weights to add a little bit of strengthening assistance for that. I think pool exercises are extremely helpful for a lot of people, particularly when mobility is limited due to pain or weakness.
That's what I heard. So Tanisha's asking, when she was diagnosed with MS, she could no longer give blood. That's what she was told. Does she need to also pass on the flu shot and this new measles shot?
Um, no, and giving blood used to be the recommendation. It no longer is. Most states, the National Blood Bank does not have that as a requirement. Anybody that's in good health, despite the fact that they've got a chronic illness, now can give blood as long as you're not anemic, as long as your blood pressure's over 100 over 60, as long as you're healthy. None of our MS medications negate our giving blood. So you're fine with that. As far as the new flu and COVID vaccines, if we're seeing that soon, I think mid-September is when they're saying that the new COVID vaccine will be coming out. I think the new flu vaccine is also coming out this week for the fall, this week or maybe next week. And the new measles vaccine. I don't think it's a new measles vaccine. It's the measles vaccine. I think you're safe to get any of those vaccines at this point.
Do you know how long after, or maybe it's immediate, after somebody does an infusion for MS, how long afterwards do you have to wait to give blood? Is there a time frame?
It really isn't. I think if we had Dr. Thrower and Dr. Boster in the same room with me. We would have that discussion and say, well, if you're not feeling, really optimal for a few days after your infusion, wait till you feel yourself again. Um, the medication with even with things like our Ocrevus and our really high efficacy infusions, that actual medication has been absorbed and is not in your bloodstream. It's been absorbed in the tissues of the body within 2 to 3 days after, and your blood levels and everything are up um, after your infusion. So I would say, if you want to be on the safe side, do it 2 weeks before or 2 weeks after an infusion. Um, but I don't think that there's any real timing other that's really associated with that.
Thank you. And Deepa has another question about low dose
Naltrexone,
naltrexone. Is it anti-inflammatory?
it can be. We hear from a lot of people. All right, low dose naltrexone is we used to call it a cult treatment, not occult, but a cult treatment. It came into being before we had any FDA approved disease modifying therapies. And people who had predominantly progressive forms of MS were taking this very low dose, it was a compounded dose of naltrexone, which is in the addiction treatment arena as a drug to reduce cravings for narcotics or even alcohol. So if you're on a narcotic pain medication, or if you are a regular alcohol user, you may find that you're not doing very well on that particular formulation. Insurance does not cover it. The regular dose of naltrexone would be 50 to 100 milligrams, and low dose naltrexone is in 3 and 4.5 milligram doses. So done at a compounding pharmacy. It's $40 to $60 a month, maybe at most compounding pharmacies. You might find some that are a little less than that and some a little bit more. I found when I was taking it that they did recommend taking it 3 hours before going to bed. And I tried it at one point when my insurance no longer covered my disease modifying therapy. And as I was taking it, it seemed like every night I slept a little bit less until after 9 days of dosing with low dose naltrexone, I was down to 1 to 2 hours of sleep a night total. And it took me nearly a month to get my sleep cycle back in order. I haven't heard too many other people that have done that. So it certainly is worth giving it a try. You may find that your pain may be ramped down, your fatigue may be a little bit less, unless, of course, like me, you can't sleep and then you get really fatigued. So it may be worth a try, but again, it has to be done at a compounding pharmacy and is not covered by insurance.
Okay. And what is the best therapy from back pain perspective?
Well, back pain has to be dealt with on a one-on-one basis with your physical therapist and your doctor. Everybody's back pain has a different source. A lot of times, back pain is from an injury that you may not have even realized you had before, and you're beginning to develop arthritis in your spine. And that can be causing some nerves to be compromised and causing varying degrees of pain. It could be that you've got a gait issue that you're not even aware of because it's just walking and you're not tripping, you're not falling, but you maybe got what we used to call a hitch in your get along. It means you your left leg is not hitting with the same force as your right leg is. And that's causing muscles in one side or the other to tighten, which is causing a pull on your lower back, and that's causing back pain. It could be a posture issue. It could be any number of things. So you really need a physical therapist's eyes on it.
Thank you. I just thought of this. We don't generally get questions about drinking alcohol, but it just hit me. Are there any DMTs that tell you don't drink alcohol with it?
Not, not that I'm aware of, no. Alcohol can, in some people, be problematic regardless of what medicines you're taking. There may be other medicines that you're taking that are a problem. Um, Alcohol in women particularly can be estrogenic. It can be increasing your levels of estrogen. And as we know, increased levels of estrogen often seem to be tied to slightly better outcomes in things like spasticity or pain. Lower levels of estrogen seem to make our MS symptoms a little bit worse. So if you're a menstruating woman, you'll notice the difference. When your estrogen levels are low, your MS symptoms are likely to be a little bit more pronounced. And for some women, they're much more pronounced. So
Hmm.
for those women, maybe a glass of wine with dinner or something like that might be helpful just to even that off. But again, moderation.
Always moderation. Yes. So are there any thoughts or concerns about using tizanidine for MS headaches or pain?
Tizanidine is not for headaches.
Hmm.
Tizanidine may help pain. Tizanidine is an antispasmodic. So if you're having a tension headache, I would think something like Flexeril, which is peripheral. Um, it works for peripheral tension and not central tension, which the tizanidine and the baclofen work on central spasticity. So it is not for headaches or peripheral pain like tension headaches or um, peripheral based pain.
Thank you. I don't have any more questions right now. Is there anything special you'd like to talk about?
Gosh, I should have basically gotten a list of things to talk about. We did talk about the studies that are being talked about in the news on Epstein-Barr and on the gut microbiome with MS. I did get a lovely email after the last issue of the MS Focus magazine came out from somebody who said that they were seeing themselves in so many of the articles in the magazine that the topic of the magazine, and I should pull this out so I actually get this right. Excuse me, I'm off camera for a second.
Yeah, I think I have it right here. Oh,
Yeah,
goodness
new
gracious.
thinking on MS is the summer issue of the MS Focus magazine. Now, if you go to msfocus.org and you look for the MS Focus magazine, I think it's msfocus.org/publications. All of our magazines are archived. So we've got archived copies of our magazines going back several years, and you can read all those articles in the magazine. Um, we touch on all sorts of things like why is it that we are told not to keep our medicines in the door shelves of our refrigerators? It's because it's open and shut all the time and it's not kept at a consistent
Right.
temperature. So your medication is exposed to temperature changes. Put it deep in the refrigerator so that it stays um, at a consistent temperature. But this last issue of the magazine had articles on progressive MS and dealing with the ramifications of MS progression, measuring MS progression. I know Dr. Boster's always saying that he believes that progressive MS and relapsing MS are the same disease. We're just looking at it through a different lens at a different point in time.
Hmm.
So again, MS Focus Magazine, MS Cared, or I'm sorry, msfocus.org/publications, and you'll find our back issues of the magazine, so go take a look. I
The
see you.
most incredible, my favorite thing that we create here. I stand up in front of people at live programs and I say it's the most educational, motivational, and inspirational tool that we create. I love it. So whether you're reading it in print or you're reading it online, I love it. We do have a question that someone's asking that they've been getting an occipital nerve blockage shot for pain. Is this safe for long-term use?
Is it Botox or are they just putting a numbing agent in there? It would be, if Botox we usually do about every 3 months for a nerve block for pain, or for spasticity. Generally, with Botox, it's for spasticity that's causing pain. Um, I would think that since it's occipital, it's at the back of the skull. That's the occipital area. I would think that that's for tension headaches.
And they just said that it's just a numbing agent.
Yeah. Okay. Um, it depends on how frequently it's being done. I would say if it's not lasting for more than a few days at a time, then it probably is not the right treatment for you, and they may need to look for something else to help.
Thank you. Sherry asks, she's telling us that some days her legs feel very heavy, like concrete. Would prednisone help relieve that sensation?
If you've been around me for very long, you know that I do not recommend prednisone or steroids for women, period. The more we as females take steroids, the greater the likelihood we have of breaking teeth, breaking bones, particularly as our hormonal levels begin to dip as we age. Um, Prednisone can really change your whole metabolism so that you gain weight that you don't want, which makes your fatigue worse. It makes your joint pain worse. Um, and prednisone weight is weight that doesn't come off. It really, really sticks. You have to be going on almost a starvation diet for weeks on end to get any of that weight off. And that's not good for you. You really need the nutrients of a well-balanced diet. And prednisone messes with that whole metabolism thing.
I know a couple women who are shining examples of what you just said. Everything from needing hip replacements at a very young age because of so much prednisone, steroids, and the weight that they can never take off. So I guess it's good guidance to be leery of that. Shelley, I'm going to allow you to ask your question again. You have to unmute yourself.
Yeah, so you mentioned an anti-inflammatory diet. Can you give some specifications of what food would be in the anti-inflammatory diet?
Yeah, vegetables, probably 3/4 of your plate should be vegetable fruit based. No added sugars, low salt, absolutely no added flavor enhancers, preservatives, dyes, um, anything like that. Anything that is, if you're reading labels on a product that you're buying, and there's anything in it that like a citrate or anything like that, those are inflammation causing in many of us. So you want to get anything that is a non-food item out of your system. Things that say that they're vegan, oftentimes, like I see this particularly in snack bars. They are loaded with chemicals, flavor enhancers, preservatives to make them more tasty, to make them more satisfying on the tongue. And those things can be really inflammation causing. So, getting those preservatives, the added sugars, the artificial sweeteners, um, your diet soft drinks are horrible as far as being inflammation causers. You want to get those out of your system or out of your diet altogether. So heavy on the fruits and vegetables, low on the animal proteins, maybe higher on the seafood proteins. Um, Make sure that you have a good balance of protein, carbohydrate, and fat. We used to be told keep your fat intake down to about 5 to 10% of your diet. We now know that people don't do well on that. We really need those fats. Fats are what our myelin is made of. And if we don't have fat in our diet, we can't repair our myelin when it's damaged. So aim for about 15 to 20% of your diet being fat. Aim for about 40% of your daily intake being protein, and the rest of that, about 40% being carbohydrate.
Mm. So even Splenda, stevia?
Splenda is not, of the two, stevia would be the one I would recommend because it is a plant-based sweetener. Splenda is artificial, really artificial ingredients, but it's got a little bit of plant-based in it. But again, your artificial sweeteners are not recommended if you want to keep the inflammation down. So stevia, I would say if you're going to use one, that's a plant-based sweetener.
Okay. Thanks, Shelley, for your question. Let's see. Oh, Splenda makes stevia. Michelle wants you to know.
That doesn't mean that they are the same product.
Right.
So stevia is the plant-based, Splenda's half stevia. So
Thank you. Stacy says that, well, she has a question. Do you feel that a lumbar puncture is necessary to confirm an MS diagnosis?
there's no flat answer to that. If an MS diagnosis is in question because maybe your lesions are nonspecific, maybe you don't have any brain lesions, but you've got spinal cord lesions. Spinal cord lesions can be caused by things other than MS, such as neuromyelitis optica or MOGAD, which is another MS mimicking disease. So, in that sense, a lumbar puncture may be helpful. If your symptoms seem to be MS, and you've got very, very little on your MRI that would fit the criteria to give you an MS diagnosis, yes, you would need that. If your MRIs are looking absolutely like MS lesions, the location of the lesions, the size of the lesions, the appearance of the lesions, it may not be necessary. So there is no pat answer to that question.
Thank you. So someone is asking if their MS diagnosis changes from relapse remitting to secondary progressive or even progressive, um, will this change the DMT that they're eligible to receive from their insurance provider? They're currently taking rituximab.
Tuximab is used for all forms, all presentations of MS. Primary progressive MS, the only drug that is specifically approved by the FDA in the United States for primary progressive MS is ocrelizumab, which is essentially an identical medication to rituximab made by the same company on the same machines in the same factory. Um, it's just that rituximab's been around for about 35, 40 years, and Ocrevus only came out in 2017. So you should still be able to take rituximab depending upon whether you have a relapsing form or a more progressive form of MS.
Hmm. Thank you. Joy would like to know, besides drinking water, naps, and exercising, what can she do to help with her fatigue throughout the day?
Um, in smaller doses, many people find that caffeine dosing helps them. So most of us don't wake up tired in the morning. If we wake up tired in the morning, that's usually an indication that we have a sleep disorder, such as obstructive sleep apnea. That warrants getting sleep testing done. It could be that your daytime fatigue is a result of an untreated sleep disorder. If you're not waking up tired in the morning, you might want to move that morning cup of coffee or black tea to maybe 10 or 11 o'clock in the morning so that you're able to kind of work through that morning lull, and maybe have another cup during that lull when you start to feel sleepy in the afternoon. I would avoid any caffeine, though, within 6 to 8 hours of bedtime at night, because it could interfere with you getting a good sound night's sleep.
Interesting. Okay. Well, there we are. We got that last one. Does anybody else have any questions for Cherie? Are you holding them all to the very last second? I want to say it, but I'm going to wait. Oh, let's see. Nick Overton says, hi, Debbie and Cherie. Could you explain the updated MS diagnostic? Let's see. Let's go into, let's see if that's in the chat. Yep.
I think that's in the chat.
Yep. Updated MS diagnostic
Diagnostic
criteria.
criteria. Okay. Last year at the consortium of MS centers, we heard that the McDonald diagnostic criteria from 2017 had been updated for 2024, and yet nothing has been published about it yet, even though we're in the middle of 2025. We are told that in October of this year, we will have all of that in print. But essentially, the diagnostic criteria has been changed so that we can hopefully get an earlier diagnosis so that we can start treating earlier and have people with less impact of their symptoms. It's allowing us now to do things like neurofilament light chain blood tests to see if inflammation is up in the body. And if it is, that's another thing that we can use, not to diagnose MS, but to move us in the direction of looking for an inflammatory process that's causing our symptoms. We've made it a little more. There's two new markers that we're seeing on the MRI. One of them is rim lesions, and so what we're seeing if we're looking at a 3 Tesla MRI, we're seeing this a lot on the 3 Tesla. It's really difficult to see on the 1.5 Tesla MRIs that are in most common usage. Many MS lesions have a vein in the center of them. You can see a blood vessel in the center of that lesion, and it's got a rim around it. And that rim that's around the blood vessel is a little bit darker, and they've found on brain biopsies in post-mortem in autopsies that rim is made up of decayed red blood cells. So it's like there's an injury that takes place there, causes a little bit of bleeding, and it forms a ring around that vein that turns into a lesion. So we can see that paramagnetic rim lesion. The other thing that they're basically the new criteria is showing us that we may want to do that lumbar puncture just to have the correlation with the oligodendrocytes, the breakdown of myelin, to show that it's an active lesion. It's an active source of inflammation at that point in time. So there are a few things like that which are going into the new McDonald criteria. And I think with some of those, if people have been taken more seriously a year or 2 or 3 or 4 years before they finally get their diagnosis, if those things have been taken into account, we might have gotten them diagnosed a little bit earlier and onto treatment earlier, which could have prevented some of the damage that took place over time.
Thank you. Tanisha said that she just got over COVID-19 and strep from a couple weeks ago. Does this mean that this winter is going to be bad as far as sickness for her? Because her job, I guess, takes her into home visits a lot. And with this new diagnosis and the potential to be sick a lot, she wants to know if she's going to be okay to continue with her job. We don't really know what her job is, but I'm assuming home health of some sort.
Um, I don't know that it makes that much of a difference. I mean, if you're on one of the high efficacy therapies like Ocrevus, Kesimpta, Rituxan, Briumvi, um, those drugs do tamp down your immune system so that it's not as responsive to um, attacking a virus that comes at you or a bacterial infection. So I would say there's probably no reason why you can't work. You just have to be smart and mask when you go around other people. You have to protect yourself. So I would put a mask as an every time um, accessory when you go in to meet one of your clients, when you go into people's homes. So I don't think it means you're going to get a lot sicker. I think you just need to be more savvy about protecting yourself, hand washing and masking.
Thank you. And Michelle, just trying to differentiate because she had asked previously about the sciatica. She had a bout of sciatica which left discomfort in her buttocks. Wanted to make sure it's not some new MS nonsense and just still getting over sciatica.
Sciatica, again, can be caused by a gait disturbance. This is something that needs a physical therapist's intervention with. And it's generally not a new MS thing. It's generally something related to gait or an injury.
Okay. Um, Joy says that she's done the sleep test and she still has to avoid caffeine because of GERD.
Okay.
So going back to that.
I think you're in the chat and not
I
the
am.
Q&A.
I'm trying to get rid of those. Let's go back.
Again, folks, please put your questions in the Q&A and not in the chat.
Right. We save that for just the people on Facebook. I did have somebody whose hand is up, but I don't see it now, so maybe they aren't raised anymore. But Karen would like to know what your best advice is when you need a new neurologist.
Make sure that the neurologist, if it's not at an MS treatment center, make sure that they have at least 500 patients with MS in their practice. General neurologists are not the place to go to be treated for your MS generally.
Wow, 500. Are you allowed to actually ask them how many patients?
Yes, yeah.
Hmm, okay.
Yeah, we've got a practice near where I live. We didn't have an MS center here at the time, but the practice had four neurologists. And among the four neurologists, they had about 1,500 patients with MS in their practice. They weren't an MS treatment center. And the closest one at that point was Boston, which was like an hour and a half drive. Um, and so we looked at that at that point as a good practice to go into. And there were two doctors of the five in that practice that saw the majority of the MS patients. And so they were kind of keeping up on things, and they had a couple of MS trials in their practice. Ask them if they participate in MS clinical trials. If they do, they're getting more education. If they're not an MS treatment center, they're getting more MS education than the average general neurologist is. So make sure that there's something about their practice that tells you that they know what they're doing. They're keeping up on the new treatments that are coming out for MS.
Thank you. Stacy would like to know, how do you feel about using B12 for fatigue?
It depends on what your B12 levels are. If your B12 levels are low, if they're under, say, 300, um, you probably want to supplement B12. Oral B12 is generally not well absorbed. It's destroyed by the gastric juices. So B12, if you're deficient in B12, your blood test shows that your B12 level is low, your doctor's probably going to want to have you do daily injections of B12 for a week or two, and then monthly. after that, or there's a sublingual under the tongue formulation of B12, and you just put that under your tongue. There's a really good blood supply under your tongue, so it's rapidly absorbed into the system, right into the bloodstream, rather than being destroyed by gastric juices. And that's something that should bring those levels up. My experience is when I've had a really low B12 level, I tend to be more fatigued. I tend to be more in pain. I tend to have more cog fog. And it usually only takes a couple or 3 weeks of sublingual B12 every day to have that all kind of level out. And after a month, my levels have come up from like 200 or 300 to 500 or 600 on daily sublingual. So that's not that expensive. It's maybe, I would say, see, I've got a bottle of um, Nature's Bounty B12 500 micrograms, and that's half the dose of an injection, the regular monthly injections of B12, but taken sublingually every day, it does bring those levels right up.
Thank you. Although Deepa says that she sleeps well, she also wakes up in the morning, right in the morning, with back pain. Do you think it's from being inactive?
That has a lot to do with it, but it also has to do with nighttime spasticity that may not be waking you up. So get up, get moving. Back pain as you age in the morning is very, very common, as is knee pain or shoulder pain or hip pain. So get moving and lubricating them, and that should help. And also a stretching exercise routine.
Thank you. Christina says that, well, she's asking if human growth hormones are beneficial for any of their symptoms.
Probably not.
Okay. I like those answers when you're, it's just yes, no, maybe so. Karen's asking about her neurologist. They're retiring and she said, my neurologist is retiring and I have received referrals from him. So I guess that's where she's going to go look, right?
Yep. All right.
Okay.
So that was Karen asked the question about
Right.
what if you have to find a new neurologist, what
What do
should
you
you look
do?
for?
Yep.
Yeah.
So combo of lion's mane and something else that she forgot, maybe B12. And that must have
Um,
been an answer.
Lion's mane was one of the supplements that we were told, I think it was 3 or 4 years ago at the Consortium of MS Centers. Dr. Alan Bowling, who has recently retired, was he was kind of our supplement guru. Um, he focused a lot of his neurology practice with MS patients on clinical trials with placebo-controlled clinical trials with different supplements to see what actually helped. Lion's mane can be stimulate the nervous system, the immune system, and it could, in some people, that stimulation could be enough to actually cause a relapse. If you're on a high efficacy MS disease modifying therapy, you're not as likely to get a relapse with these supplements. But again, um, lion's mane I wouldn't take.
Okay. Now, Joy says that her aunt told her about a sleep light test that her cousin had taken and it helped with his mold disease. So she's asking if you'd recommend it, if you think it would help for her.
I'm not exactly sure what a sleep light test is. I mean, there's sleep tests. Um, I don't recommend keeping a light on during the night. We get the best sleep when we block out as much light as possible to keep our circadian rhythm from waking us up too early or helping us to sleep too lightly. So this doesn't sound, as you describe it, Joy, it doesn't sound like a reasonable thing. I see that uh, Bhavya keeps ticking in. She's got some Facebook people that are asking questions. So if we need to go to the
Yep.
chat for them.
Okie dokie. Let's see. We know Splenda makes stevia. Angela says, how about modafinil for fatigue?
Modafinil for fatigue, it does help some people. Despite the fact that you're given a prescription for it to take daily, the more often you take it, the less well it works. I recommend that people take it only on days when they absolutely need to be sharp. So if you're still in the workforce, take it on days that you work, and do not take it at all on days that you're not working. Um, and it should help you make it last a little bit longer. It doesn't work for everybody, but if you have to keep upping the dose, you're not doing yourself any favors with your frequency of dosing.
Thank you. And Aaron says that he has muscle knots in his back. What's the best remedy for that?
Massage.
Hmm. Okay.
The muscle knots, I'm not certain. They're usually cause of tension. So stress relief, finding ways to relieve your stress, deep breath, and then just sort of do an inventory. What feels tight? Where do you have discomfort? And focus on just relaxing that area. You'll get better with it over time and you'll be able to help that. But a massage certainly can be very, very helpful.
Okay. Tracy says that she has a low blood count and found out that she is JCV plus. She says, I will have my first infusion in October, and I wanted to know with the flu, let's see, and the COVID booster, should I be concerned about getting it before or after my infusions? I am also a fitness instructor and always around people. I am nervous and excited to get better with a new DMT.
Okay, there's a lot of different questions in there. Um, in fact, there are so many, I'm going to bring up that question in the chat. Low blood count, meaning that you're anemic, right? JCV plus is the John Cunningham virus. Most of us after the age of 45 or 50 will have a JC virus positive. That really only comes in with MS if you're taking Tysabri. And then they look at the proportion, the intensity of that, not just positive or negative, but how high is it? The higher it gets, the more Tysabri particularly needs to be stretched out in time of dose. And switching to a different medication like Ocrevus or Rituxan or Briumvi or Kesimpta might be what's recommended with the JC Virus Plus. As far as a fitness instructor and around people, again, I'm going to give you the same advice that I gave the other individual who was just recovering from COVID and strep. Wear a mask. Do your classes when you're masked. Um, don't As people are exercising, they're breathing more heavily, and they may be asymptomatic, but they still may have a viral load for a cold or for COVID or for the flu or RSV or any number of things. So please, particularly if your infusion is starting with something like one of these B cell targeting drugs, wear a mask when you're in crowds. So I, you know, I don't know that you're going to get better with a new DMT. DMTs are designed to stop you from getting worse. For some people, they do see an improvement, but getting better is in essentially an unrealistic expectation. Um, you will get better in the sense that you're going to stop with the relapses and you're going to stop with the real severity of some of the symptoms of your MS.
Thank you. Mary says, what about heavy legs?
That's again something that you need to work with a physical therapist for. Heavy legs are because of deconditioning for the most part. You're not walking enough, you're not moving enough, you're not getting enough exercise. You may have some spasticity, which is adding to that, and all of that needs to be assessed and addressed by a physical therapist.
Okay. And Bonnie's asking, what is the best thing to do when she gets fatigue that makes her just have to go to bed?
Again, The fatigue needs to be worked up with a sleep study.
Okay.
With just making sure you're not anemic. Anemia can cause fatigue. So, there's a number of different causes for fatigue. It's not all MS.
Mhm.
Not everything is MS. There could be other things going on.
True. Tanisha says, what about the days that she wakes up rested, but she has a horrible headache, you know?
Again, the headache could be because of any number of things. You could have had a glass of wine before bed and it's causing a headache, or you could have had a couple of beers in the evening and it's causing a headache in the morning. Headaches are often a result of dehydration. So get your fluid intake up, avoid the alcohol in the evening before bed, um, and tension's another thing that can be causing that.
This person was diagnosed with MS in August and didn't receive their first treatment until December. Their vision changed drastically and they experienced extreme numbness in their feet and their fingertips. They weren't given steroids or anything. Is this typical?
It is now.
Okay.
Yes. And it generally takes a while once you've received your first treatment, particularly if it's the every 6 month infusions, it's going to take you 3 or 4 of those infusions. So a year and a half to 2 years before you start really noticing that things are ramping down.
Okay. Can you recommend a good stretching program as helpful?
Good stretching programs are helpful, but I can't recommend a specific stretching program. Again, your physical therapist is going to be your guide on that because they're going to assess what your system, where you're tight, how you need to stretch to optimally improve your own sense of well-being.
Thank you. And can you recommend anything to Christina that can help her with foot drop or any foot braces that you recommend?
It depends on how severe the foot drop is. There is a device that I discovered, gosh, probably way back around 2000, um, when I was tripping over my foot a lot. And it was called Foot Flexor, Flexr. And it's from a company called Speed Fitness. So it's www.speed-fitness.com. And the device again is Foot Flexor. And so what it has is a wide band that you Velcro around your ankle, and then it's got a 1 inch wide, heavy duty strip of twill that you put around, or it goes down and it hooks through a loop that they give you to put through the eyelets of the forward part of your sneaker. And that pulls your foot up into a neutral 90-degree position. It keeps it from flopping down as you're walking. It's about 25 or $30 for 2 of them. One of the things that I found that helped me when I was wearing it, I was getting a little bit of rubbing and chafing if I was trying to wear a sneaker sock instead of an ankle sock. I found that the tennis wristbands worked really well underneath that ankle wrap to keep from getting irritation under the band. So foot flexor, it's www.speed-fitness.com.
Um, Michaela would like us, can you put it on the chat or would you like me to do that?
I
I
think
can
I
do that.
can. Let's see.
Yep.
Oh, there we go.
Is that better than SAEBO? Here you go.
Okay. I'm sorry. Is it better than SAEBO? I
EBO.
don't know what that is.
Okay. I don't either, so I didn't know if that was the equivalent or competitor for what you just mentioned. Let's see if she
Oh,
gives that.
oh,
Let's,
I put fit. There's an extra W in speed fitness there. Take that W out in the chat.
okay. It was a foot brace she's referring to. Okay. Our last question is going to be, is magnesium good to keep muscles relaxed?
It can be very, very helpful to reduce muscle cramps in the legs, particularly. And it's usually recommended about 400 milligrams at bedtime.
Nice. Okay. Well, that does bring us to the end of our hour. If you've missed any part, it has been recorded and it's going to be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for more information about participating in a short survey that we send you right afterwards. It's really going to be helpful for us to determine the best information to give to you on these webinars and also the things that are most meaningful to you and helpful. So we would really appreciate if you took the second to do that. Our next teleconference, our next webinar, I keep calling it a teleconference, is Tuesday, September 9th. And that's at 4:30 p.m. That's going to be with Dr. Ben Thrower. He's also going to be doing his Q&A for the hour called Ask the MS Specialist. If none of you have been there, or if some of you haven't tried, try it. He's quite the doctor. So thank you everyone for joining us today, and especially to Cherie for constantly helping us educate the MS community. You do such a great job at that. Have a great rest of your day, everyone, and we're going to see you again next time, I hope. Toodaloo.